Good morning, doctors and members of the audience who have logged in. I welcome you all to this edition of the Hindu Wellness Series presented by Kauvery Hospital, Chennai. The topic for today's webinar is Hepatitis Can't Wait. It is an important topic chosen for discussion on the eve of World Hepatitis Day, observed on July 28th. And this year's theme for the day is I Can't Wait. And it calls on people from across the globe to take action and raise awareness about liver diseases. There are many kinds of liver diseases, including cancer of the liver or the fatty liver diseases caused by excessive consumption of alcohol or those induced by drugs and poison or irregular lifestyle and food habits. However, on this forum today, we will be discussing the chronic viral hepatitis that are preventable and treatable, and also perhaps much more common. To take it forward, we have with us today two highly accomplished doctors from Kauvery Hospital. I have the pleasure in introducing Dr. K. Ilan Kumaran, the Senior Consultant and Head of Liver Disease and Transplantation Center in Chennai. Dr. Ilan Kumaran has done his MS in General Surgery from Dr. MGR Medical University and MCH in Surgical Gastroenterology from All India Institute of Medical Sciences, Delhi. He also has an MRCS from the Royal College of Surgeons, Edinburgh, and is trained in minimally invasive liver surgery from Fudan University, China. With 2 decades of experience behind him and an expertise in liver surgery, resection, and transplantation, also in gastrointestinal surgery, pancreatic and gallbladder surgery and care, Dr. Ilan Kumaran will be, during the course of the webinar, talking about early diagnosis of patients and the importance of treatment in firefighting hepatitis and much more. So a warm welcome to you, Dr. Ilan Kumaran. And joining him will be our other panelist today, Dr. Kumaragurubaran from Trichy. He is one of the few hepatologists who's uniquely qualified to deal with both adult and pediatric liver diseases and liver intensive care. With an MD in pediatrics and DM in hepatology, he's among the young hepatologists in one of the largest liver transplant programs in South India. A recipient of the Young Achievers Award for his clinical work in 2012, he has several publications to his name in well-known medical journals. He's now working as consultant in liver disease and liver transplant at Kauvery Hospitals, Trichy. Welcome, doctor. So what I'll do is I'll now hand over the floor to both our panelists for a joint presentation on everything that you perhaps need to know about hepatitis, following which we'll have a short discussion and also throw open our Q&A box for questions from the audience. So audience is please requested to first listen to what our doctors have to say and then direct their questions to the specific doctor they wish to. So may I now invite you to start the session with your presentation, Dr. Ilan Kumaran and Dr. Kumaragurubaran.
Madam Basu, thank you for the kind introduction and for the opportunity to be able to talk to Hindu readers and viewers on this very special day. So the format is we will be explaining to you in detail about why this campaign and awareness needs to be about the chronic viral hepatitis and what is the treatment, diagnosis and things available regarding this life-threatening infection. And then at the end of it, as you said, we will definitely be open to questions. I would like to start off by sharing a small presentation that I have. And so, yes. So I hope everybody is able to see my presentation now.
Yes.
Sure. So, World Hepatitis Day is done to create awareness about the problem of chronic viral hepatitis. This day happens to be the birthday of a Nobel-winning scientist, Dr. Barry Bloomberg, who dedicated his life to the research of hepatitis B virus. He actually identified the virus and did not stop at that. He also gave the test to identify the disease in the patients and also developed the vaccine to prevent this infection. So I don't think there can be any other day to celebrate the World Hepatitis, not celebrate, actually to create awareness, except on his birthday alone, in whose life was completely dedicated to it. So World Health Organization has in its annual calendar 9 global health days. There are so many diseases and infections, but then as a global health problem, the World Health Organization has identified 9 major diseases, including infections and other major diseases like lifestyle related disorders. And chronic viral hepatitis happens to be one of them. This proves the importance of the major problem that humankind is facing because of chronic viral hepatitis. And sadly enough, still, I would say the awareness about chronic viral hepatitis, the potential of life that is lost because of this disease is still unaware in a major population. So we all know about liver today and the functions and the diseases that affects the liver. But then it's very interesting to note that even thousands of years ago, almost 2,500 years ago, this is a Greek legend which shows the hero Prometheus being punished by getting tied to the mountain and the eagle feeding on his liver. But out of this legend, I see a very important knowledge that the people had, which showed that the eagle would come back every day to feed on the liver, which is actually regrown to its normal size. So people even thousands of years ago knew that liver had the ability to regenerate. And not just this, the excavations from Babylon, Paris, and Italy, all of them have, this cast. On the right, you can see the clay cast and the bronze cast of the liver. All of these were detailedly studied, and people knew about the structure, anatomy, the function of the liver in such detail. And definitely, today, we are at an even bigger advantage to be able to cure several of the major liver disorders. So, what is hepatitis? Hepatitis is inflammation or swelling of the liver. Whenever somebody thinks of a liver disease, everybody is reminded of alcohol-related liver disease. Yes, almost major chunk of the chronic liver disease is because of alcohol. And the first stage of alcohol-induced liver damage is actually hepatitis, which is called alcoholic hepatitis. So apart from alcohol-induced hepatitis, there are several other causes. Like you can see, the diet and lifestyle is increasing the incidence of fatty liver in the population. And fatty liver also, when it starts damaging the liver, presents to us as hepatitis. Apart from this, there are genetic causes which causes autoimmune hepatitis. Several of the drugs and even health supplements can cause hepatitis or swelling of the liver. But today we are concerned and are going to be looking in detail about the hepatitis caused due to virus infections. And among the virus infections, there are many. These are the panel of viruses, mainly 5: hepatitis A, B, C, D, and E. Among these, hepatitis B and C have the potential to cause chronic liver disease. Chronic liver disease meaning they can affect the person, and in undiagnosed people, it starts affecting the liver gradually and manifests only at a very late stage, wherein the patient has already developed irreversible damage and presents with liver failure or other manifestations. The other major viruses, including hepatitis A and hepatitis E, mostly cause an acute infection, which means a very short-lived infection wherein the patient presents with fever, jaundice, weakness, and then finally cured in most of these patients. So what does this chronic viral hepatitis cause? In undiagnosed, untreated patients, it definitely, all of these patients have the potential to develop cirrhosis. Cirrhosis is the chronically damaged, scarred, and contracted liver. So at the initial stages of cirrhosis, sadly, there is no symptoms. But in the later stages, when the damage is more than 70%, the patient manifests with severe symptoms like jaundice, a pot belly with a belly filled with fluid, severe muscle wasting, and several other manifestations of liver failure. So apart from this, the other major problem that this liver infection causes is the incidence of liver cancer. So most of these patients develop liver cancer after they develop this liver cirrhosis, but then there is also a tendency to cause liver cancer in very early stages before even the liver is completely damaged. So to look at the magnitude of the problem, the chronic viral hepatitis caused due to hepatitis B and C is not just limited to poor countries or underdeveloped nations, but then the infection is all over the world. Every year, more than 1 crore people are dying of viral hepatitis. Even during this pandemic, when everybody is aware and talking about the infection and the death rate caused due to coronavirus, silently, every 30 seconds, somebody is dying due to the complications of chronic viral hepatitis. You can see the case load because of viral hepatitis B and C is more than 300 million when seen as a total. And definitely, in a small video, so I hope our viewers understand why this theme of hepatitis can't wait. Because all over the world, people who have been undiagnosed cannot wait for testing and diagnosis. People who are diagnosed with this disease cannot wait for treatment. Children who are born cannot wait for vaccines. And sadly, when you see the key facts related to this disease, in newborn babies, less than 43% of the children actually have access to the vaccine, something which can prevent this infection and cure them in the long term. And if you see the number of lives that is lost, more than 1 million lives are lost every year. Every 30 seconds, somebody is dying because of chronic viral hepatitis and its complications. And definitely, there has to be a greater awareness and commitment towards eradicating or at least eliminating this disease and save precious lives. And to just reiterate, more than 7% of people who are living with TB also have hepatitis B, and all over in a co-infection, the major risk factor is also hepatitis HIV infection, wherein more than 2 million people have a co-infection of both HIV and hepatitis B. So the World Health Organization and countries all over the world have taken note of this fact, and several important measures are taken. The Southeast Asian region also made a well-known popular TV film personality, Mr. Amitabh Bachchan, the ambassador for creating awareness, and he's a standing example for someone who was diagnosed with hepatitis B and is now leading a normal life with the treatment measures that are available. So more than 1 million people die every year because of these infections. Less than 10% of the people actually are diagnosed, and sadly enough, less than 22% of the people actually receive treatment. And over the world, only less than half of the children actually have access to a vaccine which can actually prevent this infection. So I requested Dr. Kumar to go on with how this disease can be diagnosed, treated, and prevented in detail.
Thank you, sir. Thanks for the kind introduction. On this World Hepatitis Day, I in fact thank Hindu for giving us this opportunity to create awareness among the public. For the next few minutes, I'll be just running few slides about basics of hepatitis, which each and every public should know. And before that, I'll thank all viewers, Hindu viewers, for listening to the presentation. Thank you. Let me go into the topic. Hepatitis. Hepatitis. What is hepatitis? Hepatitis is nothing but inflammation of the liver. Inflammation is nothing but, in common terms, it's injury. Any injury to the liver cells is called hepatitis. And what all can cause hepatitis? As Dr. Ilan said, there are viral infections that can cause hepatitis. There are hepatitis A, B, C, D, and E, and there are some non-viral causes also. There's certain medications which we take, and some genetic disorders, and autoimmune, where our immune system is against our liver. And as commonly known, as all of us have known, alcohol is known to cause hepatitis. So these are the hepatitis, that is hepatitis A, D, E, and B are known to cause. First, let me deal with hepatitis A, D, and E. Hepatitis A, commonly they spread through uncontaminated food and water, and in case of unhygienic sexual practice. And hepatitis D is usually found in people who has hepatitis B, because hepatitis D is unique. They never exist alone, and they always need a partner. So hepatitis B will be found in the individuals with hepatitis B virus, and hepatitis E, like hepatitis A, again it is spread through uncontaminated food and water. So what are the common symptoms? Fatigue. The commonest symptom is fatigue, which we all tend to ignore. Fatigue could be an early sign of liver disease. And second is itching. Itching, most of the times itching we tend to attribute to some skin problems, but it may be due to liver disease. So the public must be aware of fatigue and itching, which is the most common symptoms, and loss of appetite. They'll not be able to take regular food which they were taking in before. And as jaundice, as everyone knows, you will be easily able to identify jaundice by noticing yellow color of your skin and eyes. So what is the treatment of hepatitis A and E? Most commonly, they recover by themselves, and the spontaneous recovery is expected in hepatitis A and E. The good rest, adequate hydration, having healthy foods, have good bed rest, plenty of fluids, and having healthy foods. This will do that 90% of the time, hepatitis A and E, they recover spontaneously. So how to prevent A and E? As I said, it is spread through contaminated water and food. So practicing a safe hygiene practice would keep us away from hepatitis A and E. Just having a good hygienic food, good cooked food will prevent us from hepatitis A and E. The next is important, that is hepatitis B and C. They are known to cause chronic hepatitis. And how do they spread? They spread through blood and blood products. Any blood, unscreened blood transfusions, which is not now practiced nowadays anywhere, and direct contact with blood in healthcare settings, then sexual contact with an infected person. And tattooing and using acupuncture needles from an infected individual, sharing their personal items like combs, toothbrush, razors. And another interesting fact is that it is transmitted from a mother to child. An infant of a mother who is hepatitis B positive, the infant can get affected through hepatitis by hepatitis B from her mother. Usually, like A and E, I said A and E, they tend to manifest with symptoms, but B and C, hepatitis B and C, they don't have symptoms at their early stage. They may tend to have mild symptoms like fatigue, which we generally tend to ignore. And only at the advanced stages, when patients become seriously ill, all these symptoms manifest. So as I said, these are the commonest symptoms which you tend to miss early, that is appetite loss, fever, and dark urine. So, however, you may not look even sick as when hepatitis A, they tend to have more jaundice compared to hepatitis B and C, but hepatitis B is more dangerous than hepatitis A. So hepatitis B, as Dr. Ilan said, most of the people, that is for every 30 seconds, there is a person dying in the world with hepatitis B, and hepatitis B virus is 50 to 100 times more infectious than HIV, and it is preventable and with safe and hygienic practice, and they have a vaccine. So hepatitis B is a vaccine preventable disease. So India stands in the intermediate zone, that is 2 to 8% of the population is affected by hepatitis B. So with the infected with hepatitis, the life expectancy is decreased, and you will have a loss of quality of life and high lifetime cost spending on this liver disease, and healthcare cost increases with progression to chronic hepatitis, and it increases your length of hospital stay. So another interesting fact is that patient on hemodialysis who's having multiple sexual partners and homosexuals are known to contract these viruses very easily. So this is how the disease progresses. Usually they will have an acute infection, that is at the early stage they will be very silent. In the next 20 to 30 years, they will develop chronic hepatitis. That is the stage where the liver slowly gets damaged and the symptoms start setting in, and from then on they develop cirrhosis. Cirrhosis is nothing but scarring of your liver. Your liver gets scarred, so stiff, and it becomes non-functional. So all your signs and symptoms develop. And the liver cancer can develop at any point in a patient with hepatitis B. They need not develop cirrhosis to develop a liver cancer in hepatitis B, because hepatitis B is the virus itself is a cancer producing virus. So the acute illness usually go away in 2 to 3 weeks, whereas chronic infections, it increases the risk of liver damage, cirrhosis, and liver cancer. So this is how the stages of liver disease goes. Usually the chronic hepatitis is that you see in the left corner of your slide, and when they develop cirrhosis, they become scarred, so stiff, and on a cirrhotic liver, they are known to develop a hepatocellular carcinoma, that is nothing but a liver cancer. So these are the commonest tests. These are all blood tests to identify in what stage of hepatitis B the patient is, and based on that we will decide whether he will require a treatment or not. And the commonest test which we do in your, even you will come across even in your mass protein health check, that is your liver function test, of which you should look your albumin and your prothrombin time. They are most important, determining your synthetic functions of your liver. And they are treated by a simple tablet. Actually, hepatitis B is easily treatable nowadays, and they are treated by a simple tablets, once a day tablet, which they will have to take for about a lifelong time. Okay, all newborn and health workers should get screened, and infected mothers, babies born to infected mothers should get vaccinated with not only hepatitis B vaccine, also your immunoglobulin. If you contact your pediatrician, they will guide you on that. And to prevent this disease, we should avoid sexual contact with an infected person, avoid sharing their personal items, and do not share their razors, drug needles, and so. Hepatitis C is same like hepatitis B, and the mortality compared to hepatitis B, it is little lesser. And hepatitis C is one disease which is completely curable with your 12 weeks of your treatment. And the unique fact is that to develop a liver cancer, this hepatitis will cause cirrhosis. Only then they will have a liver cancer, not so severe as hepatitis B. And as hepatitis B, you can have a blood test for hepatitis C also to determine the quantity of virus in your 1 ml of blood. Based on that, you will be started on a single pill. This single pill is usually taken 12 weeks. Post 12 weeks, the results are very good, and they are cured of this disease. So avoid contact with blood and blood products, avoid tattooing with infected needles. These are the ways you can prevent from this disease. And a simple ultrasound for any liver check. When you go for a liver check, a simple ultrasound, which is now incorporated in all mass health check, you can ask your sonologist to look for any fluid in your abdomen and the liver size and any enlargement of the liver and abnormalities of gallbladder. And all hepatitis patients should get screened once in 6 months with ultrasound to look for any development of liver tumor, because liver cancer identified at an early stage is completely curable one. Liver biopsy, very rarely we employ these patients for a liver biopsy when there is difficulty in diagnosis. Basically, it tells you how much the severity of the damage the virus has caused. It is a simple procedure, and it's an ultrasound guided procedure, and it's a daycare procedure. Actually, patient need not get admitted for a whole day. They can come in the morning and they can get discharged in the evening itself. And this is one test which is equivalent to liver biopsy, and this is a non-invasive. The patient need not undergo a puncture. Instead, like an ultrasound, they can have a probe in their tummy to quantify the softness of the liver. It says how soft your liver and how much amount of the fat is deposited in your liver. And the testing time, usually it takes hardly 2 to 3 minutes. And these are the signs, end stage signs, which we see in a end stage liver failure patient. They may have blood vomiting, protruded tummy, having more fluid in their tummy, severely deeply jaundiced and malnourished, and they may have sleep disturbance as well. So in end stage liver disease, sleep disturbance is one of the commonest signs. It's an early sign for a cirrhosis patient. So vaccinations are now available, and in our country, vaccines are available for hepatitis A and B. And currently, for hepatitis C, the vaccines are under trial. Soon, we expect vaccine for hepatitis C as well. Thank you.
Thank you, Dr. Ilan Kumaran and Dr. Kumaragurbaran for that.
Madam, I would like to share on the surgical treatment also.
Oh, sorry,
Just a few
please.
slides.
Yeah.
So we heard Dr. Kumar speaking about the recent advancements in the diagnosis and treatment of this disease. Definitely, there are certain patients who will need surgery also as a treatment because of the complications of chronic viral hepatitis. So mainly this is required for liver cancer, wherein a partial resection of the tumor with a portion of the liver is possible, or if they've already developed a complete liver damage, they would have to undergo a liver transplantation. And also in some patients with liver cancer, if the nodules in the liver are multiple, both sides of the liver, removing is not safe, then these patients are also benefited from liver transplantation. So all the latest advances have allowed us to identify the liver's anatomy, the structure of the liver. Even though it is a single organ, there are 8 different segments of the liver which can be separately removed, preserving the remaining liver and at the same time allowing normal functions even after surgery. You can see here, by such techniques, either one segment alone can be removed or even one half of the liver can be removed to completely cure the patient of any tumor in the liver. And the recent advancements like robotic liver surgery also have made the operation simpler and safer, affecting very quick recovery in these patients. In this instance, we're able to remove the complete left lobe of the liver with just keyholes in the patient, which helps in their complete recovery. And coming to liver transplantation, it is a treatment which can be a cure for hepatitis B because the liver finally homes and stays in the liver as the final spot. If the medicines can completely remove the virus from the circulation, but then the virus in the liver can never be removed. But if the patient has developed a complete cirrhosis with liver failure or a cancer, the transplanting the liver can actually remove the entire virus load in the body, and in the post-operative period, they're actually cured of hepatitis B. But also has the ability to treat both the liver failure and liver cancer successfully. So one such patient was diagnosed with hepatitis B virus-induced cirrhosis and liver failure, and it was during the pandemic time. He was from Delhi and he could not travel at that time, and he had multiple hospital admissions, and almost he was on the verge of giving up hope. But then finally he had a liver allotted to him, and then he had to travel on emergency. He was admitted in an ICU at that time, and from that position he underwent a successful liver transplantation. And this is the patient almost 10 days after surgery, where he is, you can see, completely recovered and back to normal life. And not just in adults, even young children who are referred to as with end-stage liver disclosure, and isolating all these patients. And all these patients who developed COVID in the post-operative period were also successfully managed. And patients who were transplanted much long ago, who had COVID, had no extra risk, they had changes in immunosuppression and recovered well. So overall, transplantation is definitely a safe entity. And during COVID times, it should not be delayed because of the reason. And apart from accessibility, affordability is one major problem for offering liver transplant to our patients. But definitely, Kauvery is one of the hospitals offering liver transplant under Chief Minister's Comprehensive Health Insurance Scheme at completely no cost to the patient, and not just the surgery, even the post-operative 2 years of investigation medicines, everything is covered under this scheme. And apart from this, the Kauvery corporate funding and non-governmental organizations also pitch in to help such unaffordable patients. This is one such press event wherein we were very happy to introduce 2 of our young kids who underwent transplant at a completely no cost. And transplant is made possible by a big team. It's not just one surgeon or one physician. We have a team of surgeons, intensivists, anesthetists, physicians, hepatologists, multidisciplinary doctors, and not to forget the valuable contribution of our nurses, physiotherapists, dietitians, coordinators. All of them play their role perfectly to make transplantation a successful operation. And definitely, I would like to end this presentation by saying that this disease, chronic viral hepatitis, is a major problem all over the world, and we have an opportunity to create awareness and eliminate this infection into becoming a major health problem. And once again, I thank Hindu management, the editor, and all the viewers for being here today to participate and being on this discussion. Thank you.
Thank you, doctors, for that very insightful talk and showing us those slides for clarity. What little doubt, the questions have started coming, I'll start taking them, but just one little doubt I had. In the beginning of both your presentations, you mentioned that symptoms generally tend to manifest late. And there are also a lot of overlapping symptoms. Like you said, fatigue and itching could perhaps be one of the early signs. But then fatigue and itching is also a symptom for so many other diseases. So how will an individual, actually understand that it is because of the liver? And because it often happens, it is at the individual's level that we also delay, because if we have fatigue, we attribute it to something else and we don't go to a doctor. So how would you kind of motivate people to come early to you for early diagnosis?
Yeah, so I would give the my opinion, and then Dr. Kumar would definitely give. So jaundice is an unmistakable sign of liver disease or some obstruction in the biliary pathway. Normally, the general opinion among the public all over India is generally to, jaundice treatment. I think most of them is done with native medicines and or just home remedies. But definitely, it has to be identified whether if the jaundice is because of an acute infection, or is it because of the biliary obstruction, or is it because of liver damage. And this differentiation can only be done by investigations, which will include simple blood test and an ultrasound scan. With this, we will be able to differentiate and then go on for further treatment. And definitely, apart from jaundice, like you said, not everybody is able to identify the jaundice. Very dark colored urine is a very telltale sign. But fever, malaise, these are very common signs of a lot of disorder. Definitely, when somebody has been prolonged for more than a week, then I think it's time to actually go to a doctor and get themselves tested.
Right.
Kumar, would you like to add on to this?
Yes, sir. As said, fatigue is one of the commonest symptom, and it's overlapping. Even many other system involvement can also have fatigue. And the only way to differentiate whether this fatigue is due to liver disease, a simple blood test and an ultrasound abdomen will just tell us the diagnosis.
Right. And then you also mentioned this progression of disease, it ultimately leads to cirrhosis and liver cancer. So do we presume that is the line of progression, and ultimately all those people who start with hepatitis B or say infection end up in liver cancer?
No, I would say that the early insult is hepatitis. It's like any other injury. For example, if you take a simple injury to your skin, first you will have redness and you will have inflammation. You will see swelling around the injured area. Then it slowly heals by scarring. It leaves a scar. The same thing happens with liver also. First, if any virus is infected, then it injures the liver. It injures the liver cells. Initially, it will not be reflected outside, maybe symptomatically. The initial stages will be identified only by your investigations. Only when they progress on to cirrhosis, that is scarring. When they develop scar, those liver cells will not be functional. They become non-functional, and they will not be able to meet the demands of our body. Slowly, the symptoms will start evolving. Those symptoms are nothing but your jaundice and your full tummy, fluid in your abdomen, even swelling of legs. All those will be noted.
To add to what Dr. Kumar has said, it is very fortunate that most of the patients who actually get infected with hepatitis B and C virus, the immunity is able to actually clear them off. Most of or not, if only all of them went on to develop chronic viral liver disease, then the disease would be much more high. So you can imagine what the transmission of this virus is happening in the community. Almost more than 90% actually clear the virus. The immunity is able to clear the virus. And after this stage, several of these patients, especially in hepatitis B, go into a state called carrier state, in which state the person himself does not manifest liver injury. He does not, his liver is not getting injured, but then the virus is staying there quietly, multiplying, and the virus can get into the circulation of the patient's blood, and from through his blood and bodily fluids, it can get transmitted to the other person and cause the disease. So these carriers are also a very dangerous set of patients, wherein they do not manifest, they do not know that they have this infection, but they can be silently transmitting, which underlines the importance of screening of all the people who have not undertaken this vaccine. This vaccine that is available to prevent hepatitis B is being given for young children from day one of birth, 1 month later, 6 months later, only for last decade. Anybody more than that has never received this vaccine, and they could have all been infected and silently harboring this disease. So that shows the importance why these patients, why everybody has to be screened for hepatitis B. And then so all mothers need to be screened, every blood donor needs to be screened, everybody going for a dialysis need to be screened, definitely all healthcare workers need to be screened, because this is the population who are at a risk of sharing their body fluids, blood from other persons. So normally patients get cured, they clear the virus, somebody goes into a carrier state, and only a small portion goes on to develop a chronic liver disease, wherein the injury goes unnoticed for several years, and after a lot of damage happens, they are getting identified.
So yeah, related to your answer, I think which you have also partially answered, Dr. Jyoti Prakash Rath, he's asking that when there is a vaccine now available for hepatitis B, especially for the next generation, there is a possibility that the virus could be eradicated. So then why is there so much worry? And then, like you said, for last 10 years, we are giving this vaccine. So people who have not received the vaccine, can they take it now?
They should take it now. Taking 3 doses of vaccine gives at least 20 years, or in most patients, a lifelong immunity from getting hepatitis B. It's a very safe vaccine. Most vaccine preparations do not even have the complete virus. They have only the subunit of the vaccine, which can elicit, a good amount of immunity to attack on this virus if somebody gets infected. And definitely, it's a very safe vaccine.
Mm-hmm. Babu Krishnamurthy says that he has hepatitis C for last 8 years, and he takes LFT regularly, where total bilirubin is 2.0, and the ultrasound says cirrhosis initial stage. Should he be worried?
Kumar?
Yes, he should be under close medical follow-up. Probably he should have taken drugs for hepatitis C. He would have cleared the virus. By the time he had cleared the virus, the damage has already happened, which means he has developed cirrhosis. So he needs a close medical follow-up. As I said, he needs to be monitored for evolving signs and symptoms. When the liver functions, there are stages of cirrhosis. When the cirrhosis stages advance and he develops signs, then he might need a liver transplant in the future.
So
it is very important to know that once somebody has developed cirrhosis, there are no measures to actually reverse it. No native treatment, no herbal treatment, no allopathic medicine. Nothing can actually reverse the damaged liver to a normal liver. And unfortunately also that this liver cirrhosis can keep progressing in spite of being on close scrutiny and follow-up. If there are any other extra risk factors that are added, if this person is have the habit of taking alcohol, if he also has a poor lifestyle, then the liver damage is going to be faster. So they need to be aware of this, take care of themselves, and also be on complete follow-up for the rest of their lives for both liver disease that is getting progressing or of the development of a liver cancer.
So when you say there is no reversal of liver cirrhosis, but if a patient goes for treatment and there is surgical intervention and you remove that infected part of the liver, then can the person be kind of cured, or there is still a possibility that the disease may come back? Or the
That's an
disease
excellent question. No, that's an excellent question. So when the liver has damage, the entire liver is a hotbed for developing cancerous tissue. So removing one portion can actually avoid the risk of that disease growing and spreading to other places, but it cannot prevent new cancers being developing from other parts of the liver. So they need to be on continuous follow-up.
Okay. Kapil Raja wants to know what is the threshold of bilirubin in the blood which gets labeled as jaundice.
Any bilirubin 2 and above.
2 and above.
Total bilirubin 2 and above.
Okay. So since we are focusing on hepatitis B and C, Dr. Kumar, what is the treatment span for a patient, average? Like from the day a patient comes to you till the day you feel that, okay, the patient is now good enough to live and take care of himself or herself.
For a chronic,
kind of dependent on age also, the age factor counts or whatever. Severity of the disease is one thing, but I mean, what is the normal span?
Okay. I'll put you in simple words. For hepatitis C, when the treatment is initiated for hepatitis C, usually the duration of treatment is 12 weeks. 90% of the patient gets cleared the virus with treatment in 12 weeks. That is 3 months time. Whereas for hepatitis B, we identify the stage of the disease. At a certain stage of the disease, our own immune system takes care of the virus and it keeps the virus under control, where we don't initiate treatment for such individuals. Whereas individuals who require treatment, where their immune system is not able to take care of the virus, we just add on an antiviral drug. Usually when they are initiated, the treatment is lifelong. For hepatitis B.
Right. No, so when the patients are under this kind of treatment, is it also affecting any other organ? Does it have any other side effect simultaneously, like something else goes wrong in the body?
These drugs are usually safe and they don't have any major side effects. But anyway, when we initiate them on treatment, we tend to advise them to be under our medical follow-up very closely. But these viruses not only affect liver, they can affect other organs as well. They are called extrahepatic manifestations. Usually, other than liver, they affect other organs like kidneys. This hepatitis B is known to cause kidney damage as well, and they can cause skin lesions. And these are commonly, and they can even affect your central nervous system as well. These are extrahepatic manifestations of hepatitis B.
So are there any specific medicines or drugs that kind of also cause viral replication in the liver?
There are no specific drugs that cause viral replication, but when a hepatitis B infected
the audio has gone. Kumar Guruban, your audio is not there, missing.
They can have liver damage. So such patients needs to be evaluated carefully and then started on antiviral drugs before initiating chemotherapy. And steroids is one drug that is commonly used post-COVID. We tend to see patients presenting us with jaundice, and we check them for a viral screen. Hepatitis B and C were B positive because they were put on steroids. Steroids is one immune suppressive agent.
Dr. Ilan Kumaran, like somebody is asking, since liver can regenerate, so
Yes.
whether it is possible to transplant a brain dead person's liver to say multiple of liver patients in need, like what is the demand on, since you do liver transplants, or what is the wait list like? And
So in our country, there's no registry of liver patients to exactly estimate the amount of liver failure and the need for transplantation. But then, based on the reports from Apex Institution and several centers, the rough estimate is around 25,000 operations a year, and it's sad to note less than 2,500, 3,000 operations are being done in our country. And most of them, more than 90% of these operations is actually done by the living donor technique, where one of the relative blood group matched 18 to 55 years. After several stages of evaluation, if their liver is found to be adequate and fit for donation, then these patients undergo surgery and a portion is removed and transplanted into this patient. But with regards to his question about brain dead person's disease donation, see, this regenerative capacity of the liver is for normal hepatocyte tissue. In cirrhosis, the liver undergoes scarring, and the amount of fibrous tissue actually prevents the regeneration of the normal liver tissue, and this cirrhotic liver cannot regenerate. We have seen in a normal liver, if you remove 500 grams and you do a scan to estimate after 2 months, that 500 gram is already grown back. Whereas we operate on a damaged cirrhotic liver patient, you remove even 100 gram of tissue and it never comes back. So there is no chance of a scarred liver to regenerate with any treatment available at present. Several researches are going on, but then definitely it is still not a standard of care or even to be advised at clinical bed setting. With regards to disease donation, yes, the entire liver can be removed from a brain dead person and transplanted into a patient. And if there are suitable recipients, one adult, one child, or two adults who are not very heavy, the liver can be shared. This we call it as a split liver transplant, where this liver can be split and be transplanted in two different patients.
So I asked this to both of you doctors, like what is the post-surgery treatment required for a patient? I'm sure, I mean, the patient has to be on lifelong medication, as you mentioned. So even the cost of, post-surgery care is perhaps expensive. And as you said, for liver transplants or surgery, there is a government scheme on. So what about the post-surgery treatment? How do we also help patients who are poor?
Yeah, so this is a very important question because this doubt keeps, in the minds of people to take a decision regarding transplant. But it's very heartening to know that even though people need lifelong treatment after transplantation, the medicines that are required, the government has made it brought it under the rate control. The cost of medicines have been severely restricted, and with all this, definitely it is very affordable. And especially after 2 months, initially we start with high doses and a regimen of 3 different doses of immunosuppression. After 2 months, we start reducing them, and almost in a year or maximum or 2, they will be just taking 1 tablet as part of their immunosuppression, and no other medicine is actually required. And even the investigation schedules initially are a little rigorous, first 2 to 3 months, and after that it comes down to investigating once a month, gradually to once in 3 months, or sometimes even only once in 6 months. So definitely, the burden of diabetes on the population, the cost of diabetic medicines, the investigations, I would say, are much, much higher than actually the cost of treating patients after transplantation.
Mm-hmm. So is the recovery in children fast? Like if a child, say, is treated at an early age,
Definitely.
so by
I
the
would
time the
say
child grows up, can the child be free of a similar disease?
children as they are definitely make better patients. When you operate on a child, you would see if they have pain, they cry. If they don't have pain, they start playing. Whereas in adults, they always keep having the
Like,
doubt: can I move this leg? Can I get up from the bed? This suture will remove. I will have pain. So this anxiety and things are not there with the kids. So, and definitely the physiology of the child is also allows them to recover faster, and definitely the recovery is faster, and lifelong these kids live with a healthy liver, and they go on to complete their education, take up their careers, fulfill their family responsibilities, and we would not be transplanting children if they cannot live the rest of their life with this healthy liver.
Yeah. Dr. Kumara Guruban, would you like to add to it, since you've also been a pediatrician, because there's hope, we have to send out that positive message. So would you like to add to this point?
Yes, definitely. The children tolerate the post-operative period very well, and they do recover very fast compared to adults. And the immunosuppressive medications in children also, we tend to come down on them by a year or so, and they'll be on a single medication throughout their life. And even now, researchers and studies are coming up. After a few years, we are trying to stop those immunosuppression also. So children, they really do well compared to adults post-transplant.
You mentioned about those 3 doses of HPV vaccine. So Tina Datta says that she was vaccinated for hepatitis B 3 times. The second one after 1 month of the first dose, and the third one after 3 months of the first dose. So her question is whether I'm secured with respect to hepatitis B.
Yes, she can have a blood test like anti-HBs titer that will tell that whether she is a good responder to the vaccination. If the titers are good, then the vaccine she has taken up has provided adequate immunity against hepatitis B.
So she also has a follow-up question that how to make your fatty liver turn into a normal one.
There are numerous causes for fatty liver. Fatty liver, the cause of the fatty liver to be identified exactly. They can have a coexisting diabetes, thyroid disorders, as well as few genetic disorders can also produce fatty liver. So identify them, treat them appropriately. If the patient is diabetic, they should have their blood sugar under control, and their cholesterol levels needs to be kept under control. All that are addressed appropriately, then fatty liver tends to melt down.
And most importantly, diet and lifestyle. You cannot say anything less about that. These are the most important factors, and diet has to be a very balanced diet. These days, people say, I eat only 2 dosas in the morning, 1 chapati in the night. That is not enough, So it does not have to be carbohydrate all the way. You need to have proteins, you need to have fibers, and a low carbohydrate diet is actually something that we strongly advise for patients with fatty liver. They have to go on a low carbohydrate and a balanced diet, and along with that, take a lot of vitamins and regular exercise regimen. Exercise regimen is an aerobic regimen where at least 45 minutes of walking, swimming, jogging, cycling, and the target has to be essentially, if they are obese people, they have to target at least 10% of weight loss. And if they do that, it is very heartening to see fatty liver becoming a normal liver in less than a month's time.
Mm-hmm. Oh, that's very encouraging. So Dr. Rath is asking, what is the threshold percentage of liver that needs to be damaged before you think it can be fatal?
70%. If there is no way to actually estimate exactly how much percentage is damaged, but then when you start seeing manifestations of liver failure like jaundice or low protein levels, somebody having fluid in the belly, and the blood pressure inside the belly becomes very high, and new veins start developing, all these complications start happening only when the liver damage is significant, which is almost to the tune of 70%.
Mm-hmm. Mr. Ayyappan is asking that does HBsAg reactive means that he is affected, is hepatitis affected, and so how would he know the type?
Yes, if HBsAg positive means the individual is infected with hepatitis B, then there are other blood tests to stage his disease, whether he needs to be identified whether his immune system is taking care of the virus or he will require an antiviral to support him. So there are other blood tests need to be done to stage the hepatitis B disease severity. Actually, based on that, we will tell him his immune system is taking care of the virus itself, so he will not require treatment. If the immune system fails to take care of the virus, then at that point he might require a treatment in the form of an antiviral tablet.
We also discussed about this mother-to-child transmission of hepatitis. So, like at what stage and how it occurs, and what are the preventions that a mother should take? Because somebody is also asking that does it spread when an infected adult who perhaps is ignorant could be giving food while he or she is eating himself and then feeding the child with the same hand, or kissing the child? So would it put the child at risk as well? So there are basically two parts. Yeah.
From a mother to child, mother carrying a infant, a baby actually, she can spread virus at 3 stages. Either it could be pre-delivery, that is antenatal period, or during the time of delivery, or post-delivery. The risk of transmission is little higher during the time of delivery, where the body fluid secretions of the mother comes in contact with the baby, like the amniotic fluid secretions and all those things. When there is on mother's blood, if it is a normal vaginal delivery, there are chances, but that even though the transmission risk is little higher compared to the other 2 stages, that is pre-delivery and post-delivery, but the transmission rates are little low. Okay, and commonest question the mother will be asking whether they can breastfeed their baby. Definitely they can breastfeed their baby. One contraindication to breastfeeding is that if they have any cracked nipples where there is a blood ooze, if the nipples is cracked and they have a blood ooze, then they should not feed the baby. Other than that, if they have a healthy looking skin in the breast, they can definitely feed their babies.
I think the stigma needs to go. Hugging, kissing, close contact, eating from the same plate does not transmit the virus.
That's right. So you also mentioned about these statistics, 71 million and 275 million cases of hepatitis B and C across the world. So is there any categorization age-wise, like which is the age group which perhaps gets most affected?
Most of them tend to occur, that's a vertical transmission. The mother-to-child transmission is the commonest, and most of them are infected during their childhood days itself. Infant acquiring a virus, they tend to develop chronic illness 90%. So that's what I would say. And there is no definite age group, and we are not, if we screen them properly, because as Dr. Ilan previously said, most of them would have cleared the virus spontaneously. Their immune system takes care of the virus and they spontaneously clear their virus. If you check a hepatitis B surface antigen for those individuals, it will be negative, but their antibody will be positive. So most of them would have acquired a virus in their childhood days itself. And they would have
that is true regarding hepatitis B. Hepatitis B gets transmitted from mother to child. 95% of them acquired through vertical transmission. With regards to hepatitis C, the major transmission is through IV drug abuse, needles, sharing the needles, personal things like razors and toothbrushes. So I would guess this happens somewhere in the middle age, but then it does not manifest immediately. That is a problem. Whether the person acquires the infection as a child or in the middle age, they all manifest the liver disease years later. So essentially, I would expect the liver disease due to hepatitis B mostly after 40 years.
So Tanaya wants to know, can liver be regenerated in lab? And if yes, then why would we require donors?
See, you can imagine liver is the second largest organ of the body. It is 1.5 kilos of weight in a normal person. And it is not just a collection of just only liver cells. Liver has so many different functions, more than 500 functions, and so many different cells. It is a collection of hepatocytes, bile cells, immune cells, blood vessels. So it makes it very difficult to actually create the same tissue complex that liver actually is, and definitely there is research wherein there is a mesh of human or animal tissue on which hepatocytes have been regenerated. but definitely none of that has been successful yet to be advised as a treatment for patients.
So there's a follow-up question to that, doctor, that there are these days stem cells also stored at the time of birth of some people. So whether those could be used for liver diseases, because there's often this worry or threat of liver transplant rejection.
No. Those are hematopoietic stem cells mostly. They cannot be used to regenerate somebody's liver. There is no evidence. There has not been any research on this.
Vivek Jan is asking if there are any side effects of hepatitis vaccine.
No, there are no major side effects with the vaccine.
Like you said, the vaccine does not contain virus or the inactivated form of the virus. It only has a portion of the virus to elicit the immunity in the person's body. So only a single portion cannot cause infection, and it's a very safe injection.
Okay, related to diet, there is one question because you just mentioned about going on a low carbs diet for fatty liver. So somebody is saying that low carb diet has also been linked to decrease in lifespan. So how to follow low carb diet without affecting your lifespan?
It's not alone a low carb diet, it's a balanced diet, I would say. It's a low carb, moderate fat, and high protein diet. That's the ideal diet we suggest for fatty liver patients. And low carb diet is just, we ask them to avoid carbonated beverages, sweets, and so. Apart from that, not only diet, they need to have their regular exercise. Regular exercise in the form of any exercise. It may be an aerobic or a muscle strengthening exercise and whatever it is. At least they should have it 5 days a week. So a diet and exercise together will give you good results rather than following your diet advice alone.
And it's not going to be lifelong. The low carb diet is for the duration for wherein they have to reverse the fatty liver. And after that, they are going to continue their balanced diet.
Why is it that only certain individuals require, some maybe intense treatment for hepatitis, and while some others do not require any treatment at all? Or, and as we've already mentioned in the past, that some also show symptoms early, some do not show. So, like, what is the explanation to that?
Yes, definitely. The virus behaves differently in different individuals. That's what I say. If the it's because each immune system of every individual varies. If the immune system keeps the virus under control, then they do not manifest any symptoms, and usually they don't require treatment. Whereas the immune system fails to take care of the virus, then that's the point they may develop symptoms and they will require treatment.
So liver has...
And one, just to add, we like how there are several strains of viruses in COVID. There are several genotypes in the hepatitis viruses also. So the activity, the behavior of the virus also tends to differ based on which genotype the patient is actually affected. And there are several reasons for this.
Yeah, because, like while you were talking, I was also thinking like we have heart attack and heart failure. So maybe, but we have only been talking about liver failure. So if we have the term liver attack, so does it mean it gives you that gap, that period, to understand and start your treatment fast? I mean, we don't hear about liver attack.
Yeah. I think we have to sensationalize the issue to actually grab the attention of people. So I would say liver attack is more suitable for a condition called acute liver failure, wherein the entire liver shuts down. It's a normal liver, a person who is living his life normally, and because of several reasons, maybe because of acute infections like hepatitis E or hepatitis A, or because of a drug-induced liver failure or poisoning of the liver. And from a normal person, the next day he goes in for complete shutdown. 100% of the liver stops functioning. So this kind of acute liver failure can be very rightly mentioned, as you pointed out, should be called a liver attack to make people understand the seriousness of the disease.
Right. And I think there's no other better occasion than speaking on the eve of World Hepatitis Day to highlight this point. So I'll have one quick wrap up from both of you on, how would you kind of convey to our audiences and readers that who all are at risk for liver cancer, liver diseases, and what is that they should do to safeguard themselves. It's like a message on the eve of World Hepatitis Day.
Any individuals with known cirrhosis, they should have a regular screening for liver cancer, because cirrhosis is known, it's a bed for developing cancer cells. Then second is, any family member is positive with any hepatitis B or C, do screen the family members for both of these viruses. And any infected individual, hepatitis B infected individual, would need to check their ultrasound abdomen once in 6 months. And these are the commonest individual and high risk groups who should be under surveillance for liver cancer.
So I would say the ABC of liver wellness is A, avoid hepatitis. This is primarily by diagnosing at an early stage, taking appropriate treatment, and also avoiding by taking the vaccine. And B is to be careful. You have to be careful of whatever goes inside your body, whether it be the diet or medicines, drugs, and be careful about what you put inside your body. And finally, consult your doctor for an early diagnosis and treatment, because there are very advanced treatment that is available now.
Thank you so much, doctors, for that very, very informative session. And I'm very happy to see we still have a lot of questions unanswered. And if our audience members want, they could send them to you directly, and you could perhaps.
Yes. We're very happy to.
Sure.
Yeah. So I thank you all once again for joining this edition of the Hindu Wellness Series, brought to you by Kauvery Hospital. Thank you so much.
Thank you.